Here's the podcast script. A loophole brings cystic fibrosis patients a so-called miracle drug in generic form. That's the headline from the New York Times, and it's a story about one family's extraordinary journey to find a medicine their country simply can't afford. 18-year-old Joshua Lottering flew with his mother all the way from the Western Cape in South Africa to Dhaka, Bangladesh. The moment he stepped outside the airport, the humid, smoggy air triggered coughing spasms, a harsh reminder of just how severely cystic fibrosis has damaged his lungs. And yet, despite the difficult arrival, Joshua was delighted. Because the reason he'd made that long journey was waiting for him there, a year's supply of a generic version of a drug that has genuinely transformed lives. That drug is called Trikafta, made by Boston-based Vertex Pharmaceuticals. In the United States, a year's supply costs around $346,000. For patients in wealthy countries with strong insurance systems or national health coverage, that price tag, as staggering as it sounds, may be manageable. But for families in places like South Africa, it's simply out of reach. What Joshua and his mother found in Bangladesh is something of an unlikely lifeline, a generic version of Trikafta, manufactured there at a fraction of that American price. For cystic fibrosis patients in North America and Europe, this drug has already become something close to a miracle, allowing people to breathe more easily and live longer. Now, through this narrow opening, some families around the world are finding a way to access it too. It's a story about the vast and often brutal gap between where life-changing medicines are made and who actually gets to take them, and about the lengths some families will travel to bridge that gap. That's the story of Joshua Lottering and the drug that brought him halfway around the world, from the New York Times.